major depressive disorder. It is one of the most common mental health conditions in the world, yet it is frequently misunderstood as simply feeling sad. People with major depression experience persistent low mood, a loss of interest in things they once enjoyed, changes in sleep and appetite, fatigue, and difficulty concentrating. The brain's regulation of serotonin and dopamine plays a significant role, but it is rarely just one cause. Genetics, trauma, chronic stress, and physical illness can all contribute, sometimes working together over many years before symptoms fully surface. It can affect anyone at any age, though it often first appears in early adulthood, and without proper support, it tends to worsen rather than resolve on its own. Anxiety disorder. Almost everyone worries, but this condition takes worry to an unrelenting extreme. People with it experience excessive anxiety about a wide range of everyday matters, from finances and health to minor things, like being slightly late or saying the wrong thing. The anxiety is difficult to control and brings with it physical symptoms such as muscle tension, fatigue, irritability, headaches, and disrupted sleep. What makes it particularly exhausting is that it is not tied to one specific fear or situation. It simply follows the person through the day, attaching itself to whatever is available, making genuine rest feel almost impossible. Bipolar disorder. The defining feature of this condition is not simply mood swings, but the presence of distinct episodes that shift between two poles. During a manic episode, a person may feel intensely euphoric, sleep very little without feeling tired, speak rapidly, and make impulsive decisions they would never otherwise consider. Then, often without warning, they descend into a depressive episode that can be just as severe as any standalone depression. It has a strong genetic component and is frequently misdiagnosed as depression alone, sometimes for years before the manic side becomes apparent and the full picture comes into focus. Schizophrenia. This is among the most serious and most misunderstood of all psychiatric conditions. It involves a fundamental disruption in how a person thinks, feels, and perceives reality. Symptoms include hallucinations, most commonly hearing voices, as well as delusions, disorganized thinking, and difficulty expressing emotion or engaging socially. It typically emerges in late adolescence or early adulthood, often at a time when a person is just beginning to build their independent life. Despite how it is portrayed in film and media, the vast majority of people with schizophrenia are not violent, and many are able to live stable, meaningful lives with consistent treatment and support. Obsessive-compulsive disorder. The name is widely used in casual conversation, but the actual condition is far more consuming than a preference for tidiness or order. A person with OCD experiences intrusive, unwanted thoughts that arrive without warning and cause intense distress. To relieve that distress, they perform repetitive mental or physical rituals. The relief is only temporary, so the cycle begins again almost immediately. Common obsessions involve fears of contamination, harming someone accidentally, or a persistent feeling that something is simply not right. The compulsions can consume hours of a day, and the person is usually fully aware their rituals are irrational, which adds a heavy layer of shame on top of the anxiety itself. Post-traumatic stress disorder. This develops in some people after experiencing or witnessing a threatening or deeply harmful event. It is most commonly associated with combat veterans, but it can follow any trauma, including car accidents, natural disasters, or prolonged childhood abuse. Symptoms include reliving the trauma through vivid flashbacks and nightmares, going out of the way to avoid anything that serves as a reminder, and living in a persistent state of heightened alertness, as though the danger has never fully passed. Not everyone exposed to trauma develops PTSD, and researchers continue to study what determines who does, with factors like social support and prior trauma history playing a meaningful role. Attention deficit hyperactivity disorder. This is a neurodevelopmental condition characterized by inattention, hyperactivity, and impulsivity that persist over time and interfere with daily functioning. Some people struggle primarily with focus, frequently losing track of tasks, forgetting things, and becoming easily distracted even when they genuinely want to concentrate. Others are driven more by restlessness and a tendency to act before thinking things through. Many experience a combination of both. It is frequently diagnosed in childhood, but continues into adulthood in the majority of cases. It is still sometimes dismissed as laziness or a lack of discipline, when in reality, it reflects a genuine and measurable difference in how the brain manages attention and self-regulation. Phobias. A phobia is an intense, persistent, and irrational fear of a specific object or situation that poses little or no actual threat. Common examples include heights, flying, needles, spiders, and enclosed spaces. The person is usually fully aware that their fear is out of proportion to the real danger, but that awareness alone does nothing to reduce the intensity of the response. When exposed to the feared thing, the reaction can be immediate and overwhelming, sometimes resembling a full panic attack. Phobias often begin after a frightening experience in childhood, though they can also develop gradually or appear without any clear triggering event at all.